Welcome to WWDMD, a podcast that is all about peeling back the curtain on what clinicians really think and feel as they work with others. My guests, clinicians, who are also sometimes clients themselves, risk their vulnerability as they publicly share their emotional reactions to their clients, disclose their challenges in doing the work, and reveal their personal backgrounds. I'm Dr. Meyers. I'm a psychotherapist in New York City with 30 years of practice experience, specializing in anxiety and depressive disorders, as well as sibling relationships and family systems. I'm also a professor of social work at Malloy University on Long Island. I see this as a journey of self-reflection for not only our guests, but you, because with each episode, I'm hopeful that you will learn something new about yourself. Please note that any discussion of case details have been modified to protect the privacy of our clients.
What would Dr. Meyers do?
Hey everyone. Today's conversation is going to explore the topic of codependency, what it is, where it comes from, and how healing is possible. I'm going to have that conversation with licensed clinical social worker Connie Palmer. Connie, welcome, and thank you
Oh,
for
I'm so
being
glad. I'm
here.
so excited to be here. It's one of my favorite topics.
Oh, awesome. So, just to all who are listening, codependency is often misunderstood as simply being too dependent on others, but its roots run much deeper. And we're going to frame codependency not as a flaw, but as an adaptive survival response, often formed in environments shaped by trauma. And we're going to cover what it looks like in adult relationships. And as I think I said, how to heal. Connie's going to make this complex topic digestible with clinical experience and personal examples. So let's get into it. So maybe, Connie, you can start with like an overview of codependency, how it develops as a survival response.
Absolutely. So I'm a former history teacher. So knowing the history actually helps understand where our understanding is now. So back in the 50s, in the early days of Alcoholics Anonymous, the term co-alcoholic or codependent started to be used. And members of AA at that time, often men, had wives. And a lot of this was a very negative term that somehow they were sabotaging the recovery of their husbands because of their own dependency on that person or on this problem. And we now understand a whole lot about that isn't true, but that was sort of the beginning way that this was sort of identified. And, then we see that there is a lot of progression, a deeper understanding happening into the 70s, which is when I was born in the 60s, so thank God for the 70s, because a lot of really good things happened, including that the family who had substance abuse of any type, the family was involved. We see the beginnings of family therapy and thinking in systems. And in 1986, Codependence Anonymous was founded. And in that same year, the Bible of Codependency, Codependent No More by Melody Beattie was written and published. And I have read that book. It is right back there on my shelf, and it is worn out and underlined over repeated readings. Since then, back probably in the late 1990s into the 2000s, there was a lot of negativity about the term codependency. Someone, Cermak had tried to put it in the Diagnostic and Statistics Manual, and that failed. It was seen by clinicians as sort of a nothing term, a throwaway term. It was really hard for, the therapists at that time to even understand. It was very much still in the field of substance abuse. So then in 2008, Melody Beattie wrote a new book, The New Codependency, kind of giving it a little bit of a different frame. And even though there is sort of no one I think would want someone to call them a codependent, it's kind of not a compliment in our society. But yet we've seen a lot of new writers continuing to write about this all through that time until now. And I think it's because it is one of the reasons I remember that they didn't make a diagnostic category in the DSM was because there were too many of us. You know, it was just so many of us were codependent that it didn't seem like it would fit as a diagnosis. So
Oh, that's so
that just gives
interesting.
you
That's really
an idea of kind of what we've come from.
yeah, yeah. And so now, can you say more about what it looks like, or that it doesn't have to be within this framework of being in a relationship with a substance abuser, where and I assume that there's enabling as a part of that, and that there are both partners are gaining something from being in the relationship, even though one is in the caregiver position and one is
Yes.
being caregiven.
Yeah.
So maybe
Yeah.
you can extrapolate what it looks like.
You know, I think it helps to start off with the definition. So there are many, many, many different definitions. So here is mine, that it's a relational pattern, sort of something that we repeat, that prioritizes others' needs at our expense. So in other words, we end up getting harmed by this, those of us who might identify as codependent, and we're always thinking about others' needs and how we can meet those needs. So that can show up in any relationship. It can show up in a spouse. It can show up in parenting. It can show up in friendships. It shows up 100% for those of us who are clinicians, who are recovering codependents. So it really is something that I think that the world kind of needs to know about because it shows up in so many places.
How can two people be in a relationship where they're providing others' needs above their own, the other's needs?
Mhm.
Can they, that's what I was thinking about the caregiver and the caregiven, if that's a word. But,
Yeah.
how can it be two people who are both putting each other above their own needs? Is that how it usually
You know,
works?
so usually there's a receiver and a giver.
Uh-huh.
So there's, I'm sure the term narcissism is thrown around a lot in our world, and there is sort of a magnetic pull between people who are narcissists are deeply wounded in their childhoods and often are seeking out someone who can help them function and cope. So people who are very caring and giving often find themselves in relationships with people who have great and very real needs. And it's just sort of we end up sometimes being drawn into those people because then once we have met their needs, they need us. And there's a sense of security that was first built in childhood by potentially being in that same role of meeting the needs of parents or siblings, extended family members. And that security is very seductive. It gives you a sense of safety that the person will not leave you. Codependents often have this very deep fear that they will be left, that they are not lovable enough. They have their own sense of their own shame and their own unworthiness. So one of the ways that they sort of compensate for that is being really good. In fact, I would say that codependents have sort of an antennae for who's in need right now. They're very aware of the needs of others and not so aware of their own needs. In fact, sometimes not aware at all.
Boy, you're having me think about myself in a way I'd rather not.
Me too.
This is very interesting. So, I think though, I really was interested in hearing more about how it develops, like what creates this. But before we get
Okay.
to that,
Yeah, I'm gonna get
I think it makes sense to learn more about, again, how it manifests, what it looks like, how it can
yeah.
create certain types of attachment and
Yes. Yeah.
satisfaction and dissatisfaction in a relationship,
Yeah.
what the weight of it must feel like, how the fear of being left must create exhaustion of, right, always putting
Yes.
one's own needs aside. I mean, there's so many thoughts going through my mind, but I'm going to turn it over to you to ask you,
Yeah.
tell me more about what it looks like. And maybe this is where you can give either personal or professional
Yeah.
example to
Absolutely.
make it come to life.
Yeah. So I think that, it helps to just say now that what you said at the beginning is so true, that codependency, we know all about fight, flight, and freeze. Those are well known in our society as ways that people cope in the midst of trauma, substance abuse just being one type of family trauma. And what we tend to do is find ways to cope with that. We develop defensive systems within ourselves. IFS would call them protectors or managers, internal family systems, if that's a frame that some of your listeners have. And we develop those early on in life as a way to survive, as a way of trying to get our needs met in the most effective way possible, and of creating so in my family, my nickname was the Sunshine Pump. My father
Sunshine what?
said the Sunshine Pump.
Pump. Okay.
Yes. So my role was to spread sunshine, make everything okay, make everyone feel all right, and to kind of keep tap down anything that was going to bring up a lot of trauma or activate the people in my family. So I was just in this state of chronic hypervigilance, of, going from my father who had, some mental health challenges, and my mother who was physically ill, and trying to be protective of both of my brothers. And that anxiety of trying to kind of manage all of that was a really big part of my childhood. And I think we could kind of shift here to attachment theory. So I don't know how familiar your listeners are to Bowlby's attachment theory, but that what we want to have and what we want to help our clients develop is a secure attachment. So some people are blessed with that. Many of us who grew up around trauma are not. When we go through early trauma, we can develop really two different kinds. One of the types of codependency and one of the types of attachment is that anxious attachment, where you are very much pursuing. If someone is putting up a boundary or trying to get away from your, that needing constant reassurance, are we okay? Are we okay? Am I doing enough to take care of you? They will sort of avoid, and we will chase them down. We will, say, yes, I need to help you. Or we will, as soon as we are sensing that they're pulling away in some way, we become very anxious and we start over functioning, over helping. And, even, to the point of saying, I need reassurance. I need to know you love me, and just needing that constantly from people. So that's sort of, if I can add a few other F words to this conversation. So those are the fawning and feigning responses. So this is the part of us that is very afraid of conflict. That anxious, attached codependent is very afraid of any conflict because they feel alone in it and feel like they are being abandoned. So we learn to fawn. We learn to manage the moods of others in our orbit. And
Can I interrupt you?
yeah,
And in
sure, of
doing
course.
that, your attempt is to manage your own anxiety.
Exactly. That's a great connection. Yes. I'm managing my own anxiety. I'm trying to survive the best way I can. And so what I do is if dad's upset, I'm going to go take care of dad and get him calmed down. If my spouse is upset, I instinctively have to help him regulate and calm that person down because, it feels like, even though I may be 64, my survival's on the line. That
What is the
trigger.
threat? Yes, what is the threat?
The threat is being left. The threat is that not having, if we're wired for attachment, and we're very afraid when we grow up in trauma that we will be hurt physically, that we will be not, our needs will not be met. So we figure out, codependents are actually very savvy, that they're figuring out a pro-social way of getting their needs met.
So
And yes,
the
no,
conflict doesn't have to be you with the sibling, spouse, friend. It's just seeing them in distress
yes.
will lead to them leaving you. What's the
Well,
connection there?
or that I'm, there's a sense of insecurity. There's a sense of, they have a need. And first of all, if I'm meeting that need, then they won't leave me. Then they're going to stick around,
Okay.
and that will give me a sense of
They will
security.
need you. They need
Yeah.
you. Right. They
Yes,
depend on
exactly.
you. They're dependent
Yes.
on you. Right.
Yes. And
You have a role. You have a purpose in the
yes,
relationship. Okay.
exactly.
Okay.
Exactly. Yeah. And it also, is that if I feel them moving away from me, that there's this sort of, you're chasing after them. Harriet Goldhar Lerner talks about this in the book, The Dance of Connection. So that sort of what I would call the neurotic lock between people who are wanting to help and those who often have a lot of hurt and woundedness inside, but are also not very good at receiving. So we end up sort of chasing them and they end up avoiding. And that's a very common dynamic in especially couple relationships.
Wow, this is really interesting. So, give an example. I mean, you're giving many examples, but can you give a very specific example about a client or your own, exactly how this may play out?
Okay, okay. So I when my parents would have conflict when I was a kid, that's terrifying for a kid. So I would sense it brewing. And I would try to get involved in some way to try to meet their needs, try to calm the situation down in whatever way I could. And so it was meeting their needs, but also trying to figure out a way to stay safe. So I was trying to manage their moods and their emotions. And this was not conscious. This was autopilot. This is not a thoughtful decision. This is a sense of urgent need.
Mhm.
Like I'm going to jump in there and be the superhero and take care of this problem. And my family would, in systems, they're looking for me to do that.
Mhm.
That's my job is to come in and, help them to regulate themselves and try to avoid problems. So another lens to look at that is an example might be feigning. So feigning is another protective response where we would, in a situation where somebody's, having a very strong opinion and I think very differently, I will just go along to get along. If, let's say, my spouse is having a big need and I'm having a big need, people who learn how to feign are just like, well, I'm fine. We'll take care of you. I'll put mine aside. And it's this going along to get along, please and appease. So that's another way that those who have that sort of anxious attachment tend to function. And I saw myself doing that many times. Like, it's sort of like a group of seventh grade girls who get together. I don't know. What do you want to do? What do you want to do? I don't know. That's that sort of, I don't even have opinions because I have to figure out what your opinion is first.
This so resonates. I'm glad to say with the old me, but
Yeah. Yes.
but
Yes.
I'm sure
Yeah.
there's still remnants. And I'm also thinking, of course, about a couple of clients as you're talking about this. And I know that we're making the distinction between I forget the terminology used. I said caregiver and caregiving. What did you say?
Sort of that the person who's providing the needs and the person that is drawn to that person because they need it, but they're often very avoidant. They're often, very self-sufficient and not, so there's this dance that happens in that relationship.
Yes. And how does that get played out? Because as I'm hearing you speak, I'm thinking about this isn't necessarily, and correct me if I'm wrong, really co means two. Two people are involved
Mhm.
in this.
Yep.
It sounds like the need from the person to fix is
Mhm.
really in relationship with themselves in
Mhm.
regard to, feeling a sense of safety and avoiding the vulnerability or the sense of loss that
Yes.
could be impending, right, if they
Right.
don't act in their role.
Right.
But is that so that it's like it can be a struggle with oneself other than just the other person needing this person to be that way because of their own so I was going to say pathology, but we're trying not to turn this into that.
Their own trauma
Their own
reactions.
trauma.
Yeah. Hmm.
But what if one person is relatively stable and
Yeah,
the other one still has this need to fix
yeah,
or keep things
yeah,
manageable?
yeah.
Is that still codependency?
Well, so, so that let's say that I'm on a date and I'm really codependent. And if I meet someone who doesn't have this sense of I need other people to help me and help me regulate and help me figure out how to solve problems,
Right.
there's not going to be that, there is this, what I call that neurotic lock, that being drawn, looking for love in all the wrong places kind of energy that draws people together in this. And, I think that it's concurrent, that often if you do find that a codependent would be very drawn to someone who needs them, they would, or at some level, they sense that there's that sense of need. Now, that person may also be very avoidant and not like, you're smothering me. You're
Right.
like, I've already said I love you. Why do I have to say it 100
Right.
times? I'm done with this. So there's this, if you meet one codependent, you met one codependent. But there is this pattern of that they get caught up in relationships where there's need in the other person, but also there can be, when they start to pursue and insist on fixing you and helping you, sometimes it feels very smothering and they avoid.
This is a lot. This is a
It's a
lot.
lot. It's a lot to think. So let me
Ah,
paint it the other way. So people who have kind of that anxious attachment from what they've gone through in their own lives, they've had to kind of get rid of their own needs in order to meet the needs of others to keep themselves and the whole family safe. The flip of that is what, we would call avoidant attachment. So this person has two F words. They are fine. They are always fine. And they are really good at fixing other people's problems. So that person is, not willing to be vulnerable. The anxiously attached person is often very comfortable talking about their feelings and, in fact, is very focused on their emotions. The avoidant person is like, I don't want to, I don't have any needs. I'm fine. But is also often they have that avoidant attachment because they have been deeply wounded. So that their way of managing growing up in a family, and this was also true of me, was to be, I heard a term recently called glass children. These are people who grow up with a sibling with a disability, and not glass meaning they're fragile, but that they're invisible. So,
mm,
that person who is that I'm always fine, I'm always there to help everyone. And these are people, there's a really fabulous new book out by Terry Cole called Too Much, which is about high functioning codependence. So people who have more of that avoidant attachment style, they are not only doing that in relationships with their families or spouses or friends, they are overcommitted, overextended, overly responsible, and look very successful and highly functioning. So then we could have people who have both, and that is also me, yay, which is probably why I love talking about this topic so much, that, there is, this often fear of that abandonment, and I'm fine, and I can handle anything. So both of these both sides of that can manifest in a relationship. And you're sort of seesawing back and forth between what's needed in this situation. And we become therapists. We who are, there are people who come into this field who don't have high levels of trauma, who have secure attachments. And, but I think a lot of us are drawn to this field because of that. I like to help people. It feels good. And there is something that could be healthy about that, but not if we haven't worked on what Freud would call that repetition compulsion. We end up, manifesting the roles we were in our childhood in our present life until we get aware of it, until we realize that, the codependent is, whether they're anxiously or avoidant, is always in survival mode. They don't really live. They're constantly just repeating these same dynamics throughout their lives. And it makes a mess of relationships. It ends up really impacting our mental health. So the more that we can kind of just be curious about, is this me? So for your listeners, maybe some of them are like, oh, this might be me, and to do it without a sense of judgment. This is how you survive. It's not getting rid of that part of yourself, but saying, thank you. You're awesome. You helped me get through a very difficult time. And, I also want to learn how to really live my life fully.
Oh, okay, there's a lot to unpack in here. So, my first thought is the idea of when we prioritize other people's needs over our own. To this extent, is there
Mhm.
a loss of identity, or there never
Yes.
was one developed in the first place? Like you were
Exactly.
giving the example, I don't know, what do you want to do? Whatever you want to do, kind of acquiescing to somebody
Yes.
else's views,
Yeah.
opinions, values, thoughts. Where am I in this?
Yes. So, I think those of us who've grown up in families where there was trauma and where there were addictions, we figure out a way to survive. And that is the birth of the false self, the birth of the part of us that is good at surviving. It might be through fight, through freezing, through flight. Any of these things, and it's not like we all have just one. Many of us have a kind of a group of whatever we've done. And when we can begin to become aware of that is the beginning of that, developing secure attachments and realizing that there's when we're in that codependent mode, it's reactive. It's not thoughtful, it's not curious. It's I'm going to rush in and do what I need to do to keep myself and how I perceive anyone around me safe. But that, we end up enabling, we end up over functioning. People often think codependency is benign. It is not benign. It
Nine.
causes
Why would you think it would be nine?
people, are so, oh, she's, they're so helpful, they're so kind, they're so giving, right? And actually, that behavior has a very big impact on all the things I have to get rid of in myself in order to be that false self. I have to push down all my needs. I have to not set boundaries. I have to be agreeable always. I
Right.
have to be the one to solve all the problems. I
Right.
can't really exist.
Right. So
Yeah,
I'm thinking about, when does that desire, need, or just intrinsic nature to help people arising from trauma, when
yeah,
does it not feel good? Like I'm thinking about resentment and
yeah,
disappointment, right? Because if
yeah,
I'm doing this for everybody else, when do I get it in
yeah,
return? And
yeah,
and is there like a turning point, or is that part of is there it's so ugh, it's so organically entrenched in a need to be in this role based on trauma, based on a sense of safety, all of these things that you're talking about. However, is there ever internal conflict, or that's when the growth develops, when there
yeah,
is resentment and anger and disappointment that
yeah.
don't, I'm giving and giving and giving.
Yes,
And when do I, get to
yeah,
receive?
yes.
And like a
So that,
cleansing of these people in your life.
yeah.
you
So
know?
that progressive sort of healthy protest, this is not okay. I'm
Right,
getting hurt. I'm not really helping this other person. I may even be harming them
right,
because they're not developing their own sense of skills or ability to fix or their own resilience or their ability to regulate. I'm doing it all for them. And, so when that protest, but I think it always begins, and this is the good news for those of us in the profession, it begins when someone sees us. It begins when someone says, wow, what's this like for you to live this way? It
well, not
sounds,
that person that you're in that relationship with, someone else.
yeah, someone else,
Right,
a therapist, a friend,
right.
someone who's like, this sounds awful. You're getting hurt. I'm not okay with this. How come you're okay with it? And it took me a long time in therapy to find that protest. because it had been so shamed and so suppressed. The protesting would have caused, and it, for many of us, that would have been a bad idea
Uh-huh.
early on to say, I'm not helping you. No, I'm not doing that. So would have ended up being really doing more harm to us. So we find ways to survive. And I think it's sort of like that, you can't lead a horse to water, but you can make them thirsty. What I think
You
therapists
can't lead a
do,
horse to what water,
we
but
can,
you can.
right, but we can make them thirsty. Is the old saying is you
Okay.
can't lead a horse to
Okay.
water,
Right.
right? But
Right.
you can make them thirsty for the water. You can, give them a sense of there's another way to live that is fulfilling and life-giving. And my own therapist was such a gift in that, that there's another path. It's kind of like Scott Peck talks about our old outdated maps. So codependency is this outdated map of how we survived. And we eventually need, and this is a process, to develop a new map, a new way of seeing the self, a new way of seeing others. And that develops as we get secure attachments, as people see us, as people love us, and that our needs are not dangerous. Are that what both the codependent, both anxious and avoidantly attached codependents have in common is their needs have never been valued. Their needs have never been given that attention, and they've never been taught that it's okay to be, hey, I need something, and speak up for it.
Mhm.
So it's that healing process is gradual, but it's as someone is really seeing you, caring for you, loving you, and that we begin to make that shift.
Does that come with much loss? Loss of
Mhm.
relationships? I don't know, like in a marriage, if you start to work on yourself,
Yeah,
I guess you could stop doing certain behaviors, right? In
yeah,
time and
yeah,
valuing yourself. And then how's that going to affect the other person?
right.
And is that a relationship that would naturally come to an end?
Hmm.
Or the idea of like being in friendships and you
Hmm.
decide this relationship is no longer serving me and it's exhausting me,
Yeah.
and the other person clearly may have a certain character trait or personality that is not going to change through discussion, right? If this is what
Hmm.
I need, and they just can't, maybe they're too narcissistic for just as an extreme, right?
Right.
And so you have to say goodbye.
Yeah.
And in doing that, hopefully you make room for healthier relationships. But
Exactly.
I assume that there is like lots of losses, lots of mourning that are part of
Yeah.
the process.
So I've experienced that. And some of that is, it's not black or white. It's learning how to set boundaries in those relationships. Some relationships need to end.
Mhm.
We need to rise to the occasion and bring a new set of tools to that relationship where we get to exist. And I think as my, therapist had coached me with, saying no, I will not do that. Here is how I will do it. That book, Let
Mhm.
Them, that's a
Yes,
very,
yes,
it's
yes.
sort of that, like, okay, I'm not going to try to control, because
Right.
codependency is all about control.
Mhm.
I want to control that person. What the Let Them book does is let them do that. What will I do? So how do I begin to speak up for myself? But you're right, it can end up in a change in that relationship, which is hard to navigate, or it can end up to what I think Judith Vorst's book, Necessary Losses. So as we grow, as we develop, as we have a longing to live this abundant life and live it fully, we begin to be less, uh, drawn to that autopilot, and
Mhm.
we're able to say this relationship isn't working. Is it something that could be fixed, or is it something that I need to end? And there's a lot of grief, ambiguous loss and grief in that, because the person's still alive, but we may have chosen to not have contact with them or to have limited contact with them.
Yeah. Yeah. You've spoken before about depression. I don't know if this is part of the depression, but getting, or I think you'd contextualize it in getting rid of the parts of oneself
Yes.
that is feared, because that can cause a loss of connection. So can you say a little bit more about that?
Yeah, so I think so depression for me, there are people who, it's organic, it's genetic, but for many of us who've gone through trauma, for me, depression is when I am trying to get rid of a healthy part of my true self, we will get depressed. And often, people live through a chronic stage of depression because they have to live with these very real good parts of them, like the part that can say no, the part that it wants to be able to be vulnerable and need things from others, that those parts just cannot exist in that, that early childhood. They would not have been safe. So it's, the path back from depression is seeing those things as good, as a very healthy part of who we are, and regaining and seeing those parts as necessary parts of who we are. Um, and anxiety is, I don't know if any of you saw Inside Out too, but they do such a good job talking about anxiety in that. And often anxiety is that, when we have this, like, I want to say no, we'll start to feel anxious. When the new healthy parts of us start to rise up, it can feel really scary because whenever, I think this is why it's so important to see it as a trauma response. The things that have helped us survive are often the hardest things to shift because they are often pre-verbal, very young, early parts of us that have figured out this survival method. And so, there's a gradual letting go. But what replaces that old map, is having someone who's willing, or a group of people like in a Codependence Anonymous meeting, where people are walking with you who are like, yeah, you can do this. We're here to support you. My therapist used to say to me, because I'd be like, I can't set a boundary. It's too hard. I'm too scared. You will eventually. You will. It's just another lap around the mountain, and the next time around the mountain, you'll see it a little bit differently, and maybe you'll be able to do it. So there's a process involved, but anxiety, when is either that hypervigilance where we're having to, be always constantly aware of others' needs and our own pushing down our own. It can also be that anxiety of, as healthy parts come up, these other survival parts are like, no, no, no. And, they try to get rid of them, and that can cause anxiety. And as we get better, that can be a very anxious time for people where they are coming out of that comfort zone and are not yet in that growth and healing zone, but they're sort of in between. That's when they really need that support, I think, from a group or a clinician.
Yeah, as you're speaking, I want to go back to the idea of the DSM, and I'm not into pathologizing, but I do think that there's some value in understanding what someone is experiencing as a therapist, right? Because then you have ideas about what the person needs, or evidence-based practices and intervention. But so I'm wondering what your thoughts are about this being codependent, codependency being in the DSM, because there's a lot of diagnoses in the DSM that come from trauma. So
Right.
it's not, is it pathologizing or is it understanding? Like, you're framing all of this has been so incredibly helpful, because I think that I've been working with people who I might not have termed codependent, but I certainly see everything that you're talking about and feel like I'm working with them in the same way that you're relating, right, or giving example
Mhm.
of. But what would have happened if I could say this is codependent behavior? Would that have shifted things? At least to myself. I don't know if I need to say it to the client, but so what are your thoughts on that?
Well, I think what a diagnosis would do, is it would help define what this is.
Mhm.
And the substance abuse field is fully comfortable with this term,
Mhm.
whereas many of us in the mental health field, it's a squishy term. What is it exactly? Is it a behavioral pattern, or is it, a trauma response, a part of PTSD, that we have figured out these ways of when we feel powerless, we do these things that have kept us safe. So whether either way, whether it was in the Diagnostic of Statistics Manual or if we were as a field, I do a training for Rutgers and Adelphi School of Social Work Continuing Education on codependency because many of us in the field, it's not a term we know how to even define for our clients. And I do think, using the term itself in our society still carries a lot of shame. To say, hey, I'm codependent. People themselves can feel a lot of shame. There's a lot of shaming of people who are seen as codependent. So it's, I think the word, if we're going to use it, would really need to be reframed as you've developed these behaviors because you were so smart. You figured out a way to survive. And yay. And we need to thank those parts, but also consider how we can develop some other parts of you so that it isn't just about survival. So I think it takes a lot of work to help explain that term. That's why Terry Cole wrote the book Too Much, because a lot of people, she would say, well, you're codependent. And they'd be like, no, I'm not. I take care of everything in the family. I'm so capable. I'm not a codependent. And that balancing of sort of Melody Beattie's view of that more anxiously attached, person with this, perhaps that avoidant attachment who's very highly functioning, is really a much more complete definition of what codependency can be.
So as a therapist and through your own development, I'm wondering how, what this has looked like for you working with people who you consider are codependent and how that must be, I mean, we all have whatever our stuff is, right? Things that we identify with what our clients are experiencing. And then, as you mentioned, like being in recovery, right? Moving through it. And has your lens shifted at all in terms of not only how you perceive the issue, but how you relate to the client? Because when you're experiencing something similar in this way, there can be frustration with a client, there can be over-identification,
Yep.
there can be judgment, right, that you're projecting your own sense of shame. A lot can go on. So what has been your trajectory with this?
So everything you just said was part of my process, that dawning awareness. I think when I first became a social worker back in 1992, I really felt like it was my job to fix clients, just like my role in my family. I was supposed to make it better, and clients will want that from you. They often induce that sense of, I'm here, fix me.
Right.
And which taps in immediately to someone who's maybe just still not yet fully aware of that dance within themselves. So, I think that we often do over-identify, and we have a hard time challenging our clients. It can also be pseudo therapy where we just identify with each other's victimness, victimhood, rather than, being able to challenge or confront our clients. We often have difficulty setting boundaries with clients. The burnout level in the field is huge because I think we are all working ourselves out of doing it this way and doing it in a much more life-giving way. And being able to, be less reactive and more thoughtful and more curious, so that ability to, I think, most of being a good therapist is walking with our clients, walking with them, not feeling like we have to fix them, not, feeling like we have to take away their pain, but being with them in this, very real shift from this old survival path to this new way of being, which is life-giving, is really our goal as clinicians. And that was a long journey for me. Now what I do in Therapeutic Learning Connections is I'm going out and teaching this. I no longer am a therapist, but I spent many years in the trenches And I feel like my calling is to really go out and doing what I'm doing with you, Amy. But I wanted to say that the three things that have sort of helped me shift in terms of my role in, as being a helper, even if it's as a friend, is that there's really an ABC of healing from codependency. So the first one is agency. People that go through and experience trauma often don't feel a sense of agency because they haven't had any. They have been actually victims of, or things that happened early in their lives when they couldn't protect themselves. So rebuilding that sense of internal locus of control that I even teach people to say, my name is Connie and I have power. It starts with that. And then the question of how will I use my power? Codependents are very powerful people, but they're often using their power in a way that doesn't serve them and others.
Right,
You
right,
know,
right.
it's discerning how do I use my power effectively. I read an article by Eugene Peterson. It's about learning how to care and how not to care. So
Mm, mm,
it's almost an unlearning.
yes,
So that's the A of just rebuilding that sense of agency, helping that person set boundaries, helping them know how to set them. What language do you use? The B is developing a sense of belonging, which is what I call welcome aboard the human bus. It's just everybody, there are some very blessed people who didn't have early trauma, who had secure attachments. And that's beautiful. We need more of them in the field. But, having a sense of belonging, first for the therapist, like where do you go to not be okay? You need a place. We need a place where it's
right,
okay to say, I think my burnout is because I'm still doing life that
right,
way
right.
to some degree. And where can I find places to talk about that? Where can I, be vulnerable? And because if we avoid our vulnerability, we end up suffering and other people suffer. So practicing vulnerability, as Brene Brown, has done a lot of sharing, being able, I do this little question in a lot of my workshops. I ask the therapists, social workers, I say, which one is the hardest for you? Giving help, that's never the one they choose. Admitting you need help, asking for help, or receiving help. So most people in our field, when they type into the chat, they find receiving help and asking for help and even admitting that they need help the hardest things to admit. So when to serve our clients well and to, do good to ourselves, it's really being able to practice what we preach.
Do you think
Uh,
your shift from being a therapist to being more in the teacher role has something to do with your own development? That you took agency of
yeah.
you and your desire, and here I am. I'm not trying to therapize you, but I'm just
But you're on the
trying to
right
make an
track, Amy.
observation, right? And
Yeah,
also, like,
yeah,
it's a. You would think, though, if you grew, it wouldn't be as exhausting to give to your patients in the way that maybe you had before, because now you've created boundaries. But
yeah.
on the other sense, like, I'm going to do something that's more fulfilling for
Yes,
me and taps into
yes,
other parts of me
yes,
that aren't
yes.
okay.
Which leads, you're right on track here, which leads to the C, which is calling.
Uh-huh.
Like really listening to who, what is my identity? What
Mm-hmm.
is my true self? Mary Oliver has this line in her poem, The Summer's Day. What will you do with your one wild and precious life?
Mm,
Howard Thurman, who is a mystic and a theologian in the 60s, says, what makes you come alive?
mm,
Teaching makes me come. I was a good therapist. I felt called to do it. But then I really felt like I have a public practice, I think, that I want to help people come alive, including myself. And so it's that sense of moving beyond survival to develop that a direction and a sense of purpose. And I think that that can change over time. At one point in my life, this was a yes, and it isn't any longer. And now there's another yes that I'm listening to.
I think I really relate to that because for the first half of my career, I was a psychotherapist. I still am. I have a small private practice, but then I became a professor. And this idea of also like, I think ownership that actually I do have something to offer, right? There is value in my voice and it's in a very different way. And of course, we're still helping others, right? But it's in a very different way than being a therapist. And I like that. I like the whole trajectory, the whole path to healing and how that's laid out. And I think that makes a lot of sense. And I think it's very hopeful too, right? That you don't always have to be in this position of giving, 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 because you deserve as well. Your life is valuable. And that's important messaging, right? To lead a more satisfying, gratifying life and a less exhausting life, even though it served you, right? You weren't completely abandoning you to be codependent. You were, as you said, serving need, but in a survival, traumatic mode, right?
Exactly.
And so that there's got to be, like, for you to do that now is a greater sense of stability and a greater sense of identity of who you are and sense of value in that.
Yeah. And I think that, that wise self is, waiting for us, that ability to, be wise in what we do, is the outcome of the work, of the growth, of the learning. And like you, I feel a sense of like, when you find gold from your own life experience and your own experience with clients, it's like, how can I not share this? It is, and this particular topic is so misunderstood. And,
Mhm.
when I created the trainings, I was just, it felt like, yes, I need to be talking about this. So that's why I was so glad when we chose this topic, Amy, because it was just, something that I think could be a gift, hopefully to your listeners and to other people as we get this word out there more
Right.
fully.
Right. And it's healing because it's also validating, right? It's kind of a repetitive cycle. That's awesome. So what do you want to leave the listeners with, Connie? What's like the most important takeaway?
Yeah, I think that life is this process of unlearning the ways that we've survived. And that's a process because, as I said, I want to give us a lot of grace to, we have a society that's like, fix me quick, that this is, when we have figured out a way to survive, that becomes a very hardwired part of our system. And I think therapists can get very frustrated with clients, we call them resistant, and it's really the question is, how can you find a place that's safe enough, wherever that is, to do this unlearning and a relearning, so that you can have the life that you have always longed for.
Mm. Mm. So well said. Connie Palmer, thank you so much. She is a licensed clinical social worker, and if you are as amazed by her as I am, you can reach out to her at Connie@tlconnections.org. I can't wait to welcome you back. Thank you, Connie,
Thank
so
you so much
much.
for this opportunity. What a gift.
Thanks for listening. I really do appreciate it. If you like what you heard, please consider leaving a rating and review on your podcast platform, and don't forget to subscribe so you don't miss my next episode. If you're struggling with clients, I'm happy to consult or provide supervision. Consultations are also available for any person listening. If you're struggling with sibling abuse, you may want to join my sibling abuse workshops. I'm open to feedback on topics you'd like to hear or questions, so feel free to email me at drmeyerspod@gmail.com. You may be interested as well in checking out my blogs on my website at amymyersphd.org.
I've got some problems, yeah, I've got some questions. I need some help, point me in any direction. Clinical guidance is what I need to help me become who I'm meant to be. I've been searching for a teacher, another point of view. And I've been asking myself, what would Dr. Meyers do?